everyone, and thank you so much for joining PreMedCC today. My name is Kirsten, and I'm a part of the programming team here at PreMedCC. And I'm excited to introduce you all to our speaker, Dr. Miko Fogerty. Born in London, Miko Fogerty moved to the US with her family when she was 2 years old. And at the age of 12, she was one of six ballet dancers featured in the award-winning documentary First Position. Her accolades include the gold medal at the Moscow International Ballet Competition, bronze medal at the Youth America Grand Prix Finals, and being a prize winner at the Prix de l'Islam. Miko joined the Birmingham Royal Ballet as the youngest member in 2015 and toured around the United Kingdom. Although Dr. Fogerty's ballet career was flourishing, she could not ignore her goal of pursuing a college education and discovering the world outside of ballet. She started at Feather River College and Contra Costa College, where she earned her chemistry and biology associate's degree before transferring to UC Berkeley. Dr. Fogerty, graduated with a bachelor's degree in integrated biology in 2020, while also researching brain tumor therapies at the University of California at San Francisco. Currently, Dr. Fogerty is a fourth-year medical student studying to become a foot and ankle surgeon at the California School of Podiatric Medicine. And this past March, she successfully matched to Beth Israel Deaconess Medical Center, which is a Harvard Medical School teaching hospital for residency and specializing in foot and ankle surgery. So please welcome Dr. Fogerty.
Thank you so much. Thank you so much, Kirsten, for that wonderful introduction. It's such a pleasure to be back on. I think I held a webinar like this a couple years ago, so I'm so excited to be back on. And I wanted to kind of add on that, as much as I loved dancing ballet professionally, like I had this great interest in healthcare and medicine, just as a lot of you are. And I have had no regrets like going towards podiatry. But yeah, I wanted to kind of delve into what even is podiatry. I didn't even know about it till probably my junior or senior year of college, and maybe delve a little bit into, why I chose that career path and what podiatrists even do. And how it's been. But I guess I can start at the very beginning, like even from my community college days. I remember just being a pre-med, no idea about podiatry, was doing my prereqs at both Feather River College and Contra Costa College in California. And I think at that time my goal was to, transfer to a bigger university and then pursue either an MD or DO degree, and or even like physical therapy. That was something I was kind of interested at that time. Um, and and then yeah, after I tran and then actually during my second year of community college, I met one of my best friends, Riza, who ended up being my pathway, I guess, to podiatry because she started podiatry school like a year earlier than I did. But yeah, I was able to transfer to, as I maybe you mentioned that, to UC Berkeley, and I was super excited to go there because my dad went there, and I just loved the school. So finished my biology degree at UC Berkeley, and yeah, during that time, I was like, discovering different careers within healthcare. And oh yeah, I think if you have any, questions or anything, just make sure to type them in the chat or just save them for later. Anyway, so yeah, during my college, I discovered podiatry. Basically, my best friend Riza, who just started in podiatry school, was like, "Did you ever hear about podiatry before?" And I was like, yeah, I think I've heard of it, but I thought it was just, like a foot and ankle specialty I go through MD-DO school to get into, and that was my only way of becoming like a surgeon was to go through MD-DO school. I had no idea that there was even this whole other type of degree that's out there in the US that you could become a surgeon with, and it's like actually the fastest way you can become a surgeon. So she told me like it's one of the best kept secrets of medicine is this one degree where it's it's the same as MD-DO school where it's 4 years of like post-grad studies. And then you have to do a residency, like a surgical residency for 3 years at least. And then you can choose to do another year or two of fellowship if you want to specialize further. But basically, from the beginning of that school, you already know that you're going to be matched. We have like a 100% match rate. And actually, there's more residency spots than there are um, like applications. So that's something that's really nice about our profession. And so when she told me those things, and she was like, you can do surgery, you can work with athletes, you can work with dancers. Like I used to be a dancer, so that really spoke to me. You can work with kids, you can work with adults, you can work with people, a population that are diabetic. And it's pretty nice lifestyle, but you could still be a surgeon. So when I heard all of those things, I was like, this can't be real. Like this sounds too good to be true. And yeah, I did a little bit more research. I actually shadowed a podiatrist in the Bay Area at that time just to learn more. And I really loved what I was seeing. Like, honestly, everybody was so nice. Honestly, everyone was really nice while I was shadowing, and that's kind of like what I really like to see. And they were so hands-on. Like that's something I really liked about our field too, is that we're really hands-on with our patients. Like you're really doing a lot of the dressings yourself. Of course, the surgery is very hands-on, and I like working with my hands. So once I saw that when I was shadowing, I also took a gap year after college. So I think I must have been in my fourth year, like last year of college, maybe even in my gap year that I was shadowing. I think I was taking my MCAT around the same time. And yeah, I was like, this is actually my dream career is like to go into something like this where I get to do a little bit of surgery, but I get to do sports medicine. I get to work with my hands. I get to see a variety of patients. It's not like necessarily life or death too, like our specialty. Like we're not working with, people that are about to like die in our hands kind of thing. Like it's not super stressful in that way. And the one last thing was that like the patients were so happy afterwards. It's like you can make a noticeable difference during your appointment just by giving them some offloading, even by like trimming their like corns and calluses. The patients get a lot of relief. So the patients are like very happy afterwards, and that's something that I love to see as well. So basically, yeah, I felt like this was something I wanted to continue pursuing. And after my MCAT, yeah, I applied to like DPM. So that's why there's a DPM after my name because it's Doctor of Podiatric Medicine. Um, and yeah, it's a doctorate programs. And I think there's about 11 now in the country. Not a ton. There's only 11. But it's throughout the country. There's one in New York, Chicago, San Francisco, LA, a new one in Texas, new one, I think near Michigan, and a couple others, but I applied to the California ones because that's where I lived, as well as the New York one and the one in Arizona. And I got into all of them, but I wanted to be close to home, so at that time, so I decided to attend school there. And yeah, I'm now just finishing off my fourth year, which is super crazy. Like it went by so fast. And even like hearing you introduce me with like Dr. Fogerty like sounds so foreign because I don't know if I can even say that yet. Like even though I'm graduating this month and I'm a doctor this month, it's hard to get my head around that. But yeah, it's been such a blast, and I can definitely talk a little bit more about my school experience and about podiatry. But I like any questions so far?
Yeah, well, I've been calling you doctor for a couple of years now, but the little C is to make it says candidate. So
Yes,
it's
thank
like
you.
it's like to be official. So if somebody ever stops you, be like, well, I'm not proclaiming it's I'm a candidate. So we'll drop the C when in a couple of weeks.
Yeah, yeah, candidate of this. But Yeah, it's crazy. I'm again super excited to talk to you guys. And yeah, any questions so far or anything I should go into so far?
Yeah, I had a question. Just like hearing you talk, can you kind of, I guess, like differentiate between, you said that like this degree is like the fastest way to become a surgeon. Can you kind
Mhm.
of differentiate like in terms of maybe quantity, like like general surgeon versus foot and ankle surgeon, like what would the years of schooling kind of look like?
Yeah, so like we all have the same amount of like medical school. So that's 4 years. Like no matter what, podiatry or any other specialty, it's 4 years to become a doctor, at least in this country. And then I meant in terms of residency. So residency spans for any kind of doctor from 3 years to 7 years. So like 3 years, like is the shortest you could do anyway. I think there's like family medicine or maybe like a lot of primary cares within the 3 year span, and then like general medicine, I mean, general surgeries around 4 to 5 years, orthopedics around orthopedic surgeries around maybe 5 years, I believe it is.
Yeah,
Um,
5.
five, yeah, and then like neurosurgery is like 7 years. And so yeah, 3 years is like pretty the shortest it could be in terms of residency time. So that's kind of what I meant is like 4 years of medical school plus 3 years of residency training is all it takes to become a foot and ankle surgeon as a podiatrist. Um, there's also the pathway of going through MD and DO, where you do an MD DO school for 4 years. If you want to do foot and ankle surgery, where you do 4 years of MD DO school, and then you do a orthopedic surgery residency, which takes 5 years, and then you specialize further within foot and ankle surgery, which takes another year. So it's either like it would be 6 years of residency training at least. So it's either like go through the podiatry route, where you know from the beginning you're only going to be doing foot and ankle surgery. Like you can't really do much else. But that's all you can do. Or if you like, or do the ortho route and you can do other things like shoulders, backs, all of that. But it just takes a lot longer because you have to be trained in all those other parts of the body too. So that's kind of what I meant in terms of how long it takes to become a surgeon. Did that answer your question?
Isn't
Okay.
it true that in California, DPMs can be first assist on
Yeah,
any surgery?
that's true. That's true too. I almost forgot about that. Yeah, basically, like you can, as a doctor of podiatric medicine, you can, scrub in with any ortho. It's like totally legal, to be the first assist to, you can scrub into shoulder surgeries or back surgeries or hip surgeries or knee surgeries or whatever other surgery, and that's totally legal for us to do if we want to be doing those surgeries as well. So yeah, absolutely. That's definitely something we can do as well.
But the reason most podiatrists don't do it because they have enough business as it is. So it's like,
Yeah, like they're happy with, their domain of being a foot and ankle surgeon, and we have way enough patients. Like if anything, there's not enough podiatrists, to be honest. So there's already an overload of patients that we have. So, but I do know a couple podiatrists that, love surgery and love to see other types, so they do that. But yeah, I almost forgot about that myself. Like, but that's definitely something you can do as a podiatrist. And in terms of our scope for surgery, it depends on the state. Actually, California has the best scope in the US, so we can do, of course, like ankle fractures. Like if someone's broken their ankle in multiple places, we can totally fix that with, screws, plates, all of that. We can also do like total ankle reconstructions. We can do total ankle replacements where we totally replace the ankle. We can, if the heel bone, the calcaneus is fractured, we can totally fixate that. Obviously, we do like bunions, hammer toes, Achilles ruptures. Like if you've heard of like any athletes with Achilles ruptures, podiatrists, at least in California, are able to do that, and most states. Yeah, ton, and also we have a huge like diabetic population as well. So, um, helping them with trying to save their legs and feet when their immune system isn't working well is something that podiatrists do as well. And some babies are born with congenital deformities, and if you've ever heard of clubfoot, it's like when their feet are all turned inwards and really arched when they're born. So podiatrists treat that. And yeah, I mean that's something that I love about our specialty is we can kind of branch into different um age groups or do all of the above. Like you can totally do all of the above. And yeah, so that's kind of a little bit about our scope. But it is a little bit different between states, but it's mostly most states can do all of those things. Yeah.
And to kind of like follow up on that, so you kind of like you already knew that you wanted to apply specifically to these schools, or do you also apply to like MD only programs, or just solely like DPM programs?
It's up to you. Like you really can like it's basically the same application. Like it's just a personal statement, couple letters of recommendation, same prereqs, completely same like yeah, basically it probably took me like maybe 15 minutes to re like to change the application between like MD and DO and DPM. Yeah, so it's basically the same application. So if you're applying for MD DO schools, might as well apply to a couple DPM schools that you might be interested in, because it will probably only take you like a couple. You just have to, ask your letters of rec to maybe send it to the right whatever, email it or whatever it is, website. But other than that, like it's basically the same. So, yeah, same application. Yeah.
Awesome. There's just a shout out in the chat or like in the participants that we have today. I wanted to bring up this student has been a fan since or a fan of yours since first position, and they did
Oh,
the pre-professional ballet up until 18 years old, and
oh my
then
God.
they majored in dance in college, and they're planning to apply to MD this cycle, but knew nothing about podiatry. So they just wanted to thank you for your time.
Oh, of course. Well, I want to thank this person. Thank you so much for your support through the years. Yeah, like First Position was filmed, I think, in 2010. So it's like 15 years ago, which is so insane. I can't believe I'm so old now, but yeah, I was just so grateful that that film happened and that I was able to be so lucky to be a part of it. For those that don't know, like First Position is a documentary about like competitive ballet dancers that like how they prepared for like an international ballet competition, and it was a documentary on like six kids from around the world that how they prepared, and I just really was lucky to be a part of that and be one of the six kids that they featured. And so yeah, and then that like documentary became like so much bigger than any of us thought. So yeah, I'm still to this day when someone says that they've watched that film, I'm like so surprised because we never expected it to be anything other than just a home video we can look back on years later. But for so many people to have watched it, and I guess, I was able to get some recognition, at least in the ballet world, from that film. So it's just so special. And yeah, I'm really thankful for, those that are watching that might have been in the ballet world and are considering other careers. It's not always easy leaving ballet because it's something most people start so early in their life. Like I think, gymnastics, ballet, and ice skating are like three athletic activities that people start very, very, very young. And when you start so young, it's all you know for so long. And then a lot of people, at least in the ballet world, don't always even plan on going to college, especially if they're going down the professional route. Like most like professional dancers like go straight from high school to their company, so they don't even go through college. And actually, when I was growing up, I never planned on going to college. Like I never literally never thought I was going to go to college. I thought I was just going to be a dancer for, I don't know. And that was all I thought. Like, and so when I did join a company ballet company and realized I didn't want to continue in this profession. That was a really hard realization because I had no idea, like at that point, what I wanted to do. Um, and I'm, grateful that I had, in a way, experienced some injuries myself and had worked with podiatrists. Actually, I broke my second metatarsal in my foot and, worked with podiatrists to get back onto the stage. So, that kind of experience helped me decide that I wanted to go down healthcare and eventually into podiatry. Uh, but not everybody has those experiences and doesn't really know how to pivot after they finished ballet. Anyway, so a little bit of a tangent, but to any dancers out there, um, I know it's super difficult, but trust yourself and trust your instincts. And if you've done ballet, something as hard as ballet, you can really do anything that you set your mind to. And I really believe that for sure. And I'm sure for any, person that's been in any kind of like extreme athletic activity, um, I think the same thing. So, and you can really like, or even people that have been in different careers, like some of my friends used to be engineers before they'd gone into med school or like did something completely different. I think you can really use those skills that you've learned in other aspects of your life and bring it to medicine. And it just makes you a richer person, a richer doctor, because you can relate to patients in different ways um, and it just adds to your experiences. So, and I think that's one of the most important parts about being a physician or a doctor is being able to have that connection with your patients is so incredibly important. And having those experiences in your life, can only help. So never be discouraged that your path has been a little bit different coming towards medicine. But if you've landed at the gates of medicine, like go for it. Like don't be afraid. Um, anyway, so yeah, thank you for that comment and that question though. So sweet.
Um, I love that story and also like just kind of hearing more about how like you kind of like you learn more about like your interest in podiatry through that like experience in
Yeah.
ballet.
Yeah.
Um, is there anything else in the application process between MD and DPM programs besides um, like you said it was like pretty easy to do that or to like
Yeah.
kind of change your application a little bit. Is like the questions like mainly different or like is there anything like else that's different or it's fairly similar?
I think it's fairly similar. Actually, like just as you said that, I do remember that some podiatry schools might require some shadowing from a podiatrist, just because, just so that you know what you would be getting yourself into. Like you don't want to join podiatry and be like, actually I hate this. Like I don't want to do this. And then you're already like $200,000 in debt and you're stuck. Like you don't want to be in that position, with medicine in general, but like of course with podiatry. So they require like it's not even hours. I think it's just like at least one day of shadowing a podiatrist. And even my school, like they set that up for me. Like they were like, as long as you do this one day, like you're good. You're good to go. So I think some podiatry schools may need that as well, but it's a kind of a soft thing. Like they can kind of help you with that if you haven't done it. But yeah, other than that, I think, the question like I can't even remember if they had like secondary questions. I'm sure they did. It's been like 4 years now, so I can't remember exactly. And that whole year was a blur for me. I felt like it was like COVID and applications and MCAT and everything. So I can't remember exactly if they had secondary questions, but it felt like any other like MD or DO application, basically same idea. Like the main question was like, why do you want to join podiatry? Um, and why do you want to join medicine? And it could be like a very similar story that you talk about. And so yeah, very similar, other than maybe you might need a day of shadowing a podiatrist. And honestly, that is good for you either way. If you are applying to podiatry school, just in case you get in and you have to commit, you know, 50 years to this profession, you might as well have taken that one day to shadow, to make sure you actually like what this is. Because you don't want to start and then regret it and just be too far in that you can't leave. So I do recommend shadowing if you're interested. And if you guys ever need, anyone to shadow, um, just, let me know. There's also a stepintopodiatry.com that I think we can put into the chat, Step Into Podiatry, which can connect you with a mentor in your area that's a podiatrist that you could shadow. So that's a good way to also find a podiatrist in your area if you want to shadow them in clinic. I don't know if like a lot of people are allowed into operating rooms, maybe in certain places. Um, that's allowed, but that's super cool too. But even just a clinic day, I think is helpful just to make sure that's something you are even interested in doing. So yeah.
Yeah, just the problem with getting into hospitals and operating rooms is that you have to get cleared, like both medically for TB and all the other good stuff, and then also just make sure that you abide by HIPAA, and usually
Mm,
that's the only limitation.
yeah.
That's the
Um,
main limitation.
Yeah, like a lot of, especially if you want to be in hospitals, that's exactly right. Like even just to shadow, sometimes they require a lot of paperwork. Like actually today and yesterday I was shadowing. I'm in New York City right now and I was shadowing like a dance medicine doctor. Even though I'm done with podiatry school, I'm still willing to learn and especially dance medicine because that's something I'm interested in. I literally just reached out myself to, since I had some free time, to shadow some physical therapists as well as a dance medicine MD doctor and just wanted to learn as much as I could while I'm in New York. But actually had to start this process months ago. Like it's like May now. I probably started this in March or even February. I probably started reaching out and finding emails to come to this clinic because it's a really well-renowned clinic here in New York for dancers. And yeah, I knew that sometimes paperwork takes months, like 2 months is usually about the time it takes to go through everything. And again, just like you were saying, like you have to send in your flu shot, you have to send in your TB test, I had to take like four like online hour like courses just to do these 2 days of shadowing. I'm not even doing anything. All I'm doing is watching these physical therapists and this doctor do their thing. But, just because I'm within, the area that the patients are in, they need to make sure that their patients are protected and respected. And so they have to, make sure everyone that comes in contact with these patients are go through these processes. So yeah, it's sometimes annoying to have to do all of this paperwork, but it is very necessary at the same time. And yeah, something to take into consideration when you are considering shadowing. But some people just have like some doctors just have a private office that you don't, it's like a very small business. You don't have to go through all of that. They just are like, come on in, like you can whatever come in and see it's totally fine and you don't have to do paperwork. But some places, especially like bigger organizations and big hospitals, take some time for sure. Yeah.
Awesome. So our next question is, what sort of study aids would you recommend for students going into this field?
Study aids. I would say just, like it's very again very similar to being a pre-med and like you want to do well on your MCAT. Okay, again you have to take the MCAT as well to get into podiatry school, just like MDDO school. Same prereq. So study I guess study just like study at like same just like MDDO schools for that. Um, I think I used like Kaplan or something like that for the MCAT, um but for podiatry specifically, I would say don't worry about it, honestly, till you start podiatry school. Like, of course, shadow and, see if you can even see yourself doing that. And if you can, if you're interested, if podiatry is something you see in your future, if you want to work with people's feet and ankles, which is not something everyone wants to do. Like, podiatrists have to, it's not all just sports medicine. You also have to deal with wounds, like diabetic wounds. You have to deal with blood and all of that. Like, so if you're okay with all of that, then um, there's, of course, study aids within podiatry school. Um, but I think don't worry about that till you start podiatry school, until you're like in and you're, you know, ready to start. And honestly, it's probably different for every podiatry school too. I have some study guides for my own podiatry school, but it wouldn't be the same as all the other podiatry schools because the curriculum's like slightly different. And actually, I need to add that like some podiatry schools, they do their first 2 years with their associated DO or MD students. So all of their first 2 years, like they do their biochem, they do their physiology, they do their, general anatomy, like all with the MDDO students within that same school. Like I think it's like Kent University and Western University down in, and I think also maybe Midwestern in Arizona. Anyway, certain podiatry schools do their first 2 years actually with the MDDO students. And then their last 2 years is just focused on foot and ankle leg podiatry. Um, so that's something, to keep in mind. But yeah, I honestly don't have a great answer to that question in terms of study guides. I would just say just shadow, see if you want to do it. And then if you can and want to do it, then you can kind of, study once you start podiatry school.
Awesome. Our next question is, are you still able to like practice ballet while in medical school or like the past like 4 years that you've been in med school? And then I'll follow up. They have a next question, but I'll just do like one at a time so we can focus on
Okay. Okay, great question. When I was leaving ballet, so I think I stopped when I was like 19. And the year leading up to that, I was struggling a lot. Like the main reasons I would say I left ballet is um because I was just not enjoying my time on stage, especially to the point where it made all that hard work like worth it for me. Like I every day felt like a battle against my body when I was dancing. And of course, like I was dealing with like eating issues and like I was just not mentally healthy during that time. And I knew it was just stemmed from being a dancer. And if if I felt amazing on stage and it made it all worth it, I would have probably continued, but I just wasn't feeling that. So it was not worth it for me to continue in a career I was not happy in. And by the end of that time, my mom was like, you can pursue something else, but you just have to be 100% sure that you're okay leaving ballet. Like you have to be 100% sure because once you leave and it's been a couple years and you regret it, you can't, it's hard, it's going to be like impossible to come back to it. Because, it's just really hard to be in that shape again. So by the time I came to the realization that I wanted to switch careers, I was like, and once I did it, I was like 100% sure I was okay with leaving the world of ballet, which was hard. But actually, I realized that I loved teaching a lot more than dancing, like teaching ballet. So although I haven't really been dancing a lot, I've been teaching a lot. So I love coaching like ballet dancers, especially like preparing them for ballet competitions, and just helping them with their technique. So I started that probably like in my third year of college, like right after community college was done was when I think I started teaching a little bit more. And then actually, honestly, throughout podiatry school, it's only grown. Like I've only taught more and more and more. Like like especially my fourth year in podiatry school, like in the last few months, I've taught so much, like nearly 20 hours a week, probably, of teaching. So yeah, I love doing that. And I'm really glad I've been able to stay connected to the ballet world that way because I still love the art form. It's not, I didn't enjoy performing, but I love being a part of the world. And so I'm just really grateful that I'm able to do that. And yes, so basically the answer to that question is no, I'm not dancing, but yes, I'm teaching a lot. and coaching a lot. And honestly, a lot of my classmates have, been able to keep up with their hobbies. At least in podiatry school, I can't speak for MDDO school because that's not what I went through. And I don't know if it would have been the same if I did MDDO school. Maybe, maybe not, don't know. But for podiatry school, I can say I was able to keep it up and honestly increased it as I went through podiatry school. However, once I start residency this summer, I don't know if I can teach as much anymore. So we'll see. We'll see during residency if I can keep it up, but definitely not. Yeah, definitely not as much as I did this past year for sure.
That's super cool though. Um,
Yeah.
this next question is a little pivot back to like surgery. How is the work-life balance and like surgery and the surgery profession you're in? The student has heard that like a lot of surgeons kind of work a lot and have like a lot of hours they put in. So how does
Yeah.
that kind of work-life balance work specifically to podiatric, like foot and ankle surgeons?
Yeah. I would say like most podiatrists that I've talked to, I think you really can manage it yourself. Like if you most podiatrists, honestly, that I've talked to seem very balanced. Not during residency. Like residency is tough for any resident, any specialty. Especially surgical residencies are tougher because you have to kind of finish all your hospital work, like see all your like in hospital patients before you start surgeries. And surgery like usually starts around 7 a.m. So you actually have to like be at the hospital pretty early, maybe 6 to like see all your patients before surgery starts, and then you do surgeries all day, and then afterwards you need to catch up with notes and all of that. So residency's tough for those 3 years, especially the first year I've heard is really tough. But afterwards, podiatrists again, can really manage their schedule as much as they want. So I know podiatrists that, work 3 days a week, have multiple kids, live a great lifestyle, still make enough money to, live comfortably, and, live very balanced, and enjoy their life. So that's actually like a lot of podiatrists that I know are like that. There's some podiatrists that, want to kind of grind and do a bit more and own their private practice or do more research or just like really do tons of surgeries because they just love it and they just want to keep growing and keep learning. And so those surgeons can work more and, they make even more money. Might not be as balanced of a lifestyle, but that's something they chose and they want to do. But really after residency, it's really up to you. You can work as little as you want or as much as you want, and it's pretty balanced, I would say. So yeah, yeah, pretty balanced after residency.
Our next question is, as both a foot and ankle surgeon and a prestigious ballerina, what would you recommend to young ballet students in the junior division to protect their feet and prevent injuries during their daily practice?
Great question. Great question. I love this question because it kind of combines my ballet coach mind and my like podiatry mind. So I think the biggest thing, and actually it's really related to what I've been seeing in the last couple days in the dance medicine clinic as well, because we've been seeing so many dancers with the physical therapists. Anyway, I think one of the biggest thing is just like making sure the alignment is really good. Every time you do a plie, which is like the bend of the knees, like making sure that it's aligned with your hips and your feet. Making sure if especially if you're on point, like wearing point shoes that fit your feet really well, like going to a proper point shoe fitter and trying different brands, trying different sizes, and really making sure your point shoes fit you really well. That's really important. You don't want to be wearing point shoes that can be a cause of an injury. And it's hard as a dancer because you do have to put yourself through pain to become better. For example, stretching, you have to stretch so much, push your body past certain limits. However, you have to be also smart in the way that you don't push it in a way that's going to cause it to get injured and stop when you feel certain kinds of like bad pain. And that can be difficult as a dancer. Um, But yeah, I would say, I mean, I feel like I could talk about this for a long time, but my main advice would be alignment and wearing really well-fitted point shoes. And then third is listening to your body. If you feel certain pain, go see a doctor, get it checked out before it gets really bad. And start treatment as early as possible, because once you start treatment, like you'll get better quicker as well. If you don't go to treatment, ignore it, keep dancing, it can get worse and worse, and that, your healing period will also become longer. So you don't want that to happen either. You want to start the healing process. It'll be shorter, and you would have started earlier, so then you would get healthier faster. Also, one last thing is if you do get injured, I really recommend a lot of Pilates, and cross training is really, really great. Also swimming is really great. So Pilates and swimming are great, like cross training methods for dancers. So that's what I would say are some ways to prevent injury as a dancer.
I love those tips. Those are really great. And I'm sure that was helpful for the student. Our next question, also like another shout out, the student is a ballet dancer interested in pursuing medicine. And they've also been studying or like following you since first position. And so they really admired your story and your bravery. This student has kind of a question about like where it seems they have like a injury. They developed a ganglion cyst under their right lateral malleolus through ballet, and their ankle always clicks when they go to a loaded dorsiflexion. And
Yeah.
so they're asking if you'd recommend to see a podiatrist, physical therapist, a sports medicine, or all of the above regarding that issue.
Yeah, I mean, I feel like physical therapists, I mean, honestly, all of the above work together really well. You can always start with so usually what happens is like physical therapists need a prescription from a doctor. So you can either get that from a primary care or a podiatrist or an orthopedic doctor. So you have to either see like a primary care podiatrist or like orthopedic doctor first, and then they refer out to physical therapy. So usually you need to go through that pathway even to be able to see physical therapy, depending on your insurance as well. It's always different with different insurances and stuff like that. So yeah, you can totally see a podiatrist. Like that's definitely something podiatry sees, and something we treat because it's part of the ankle. And I'm so sorry that you're going through that and you're experiencing that clicking sensation. But yeah, definitely something a podiatrist would be able to take a look at, maybe, even, like ultrasound or MRI, just see what's going on. And then I think physical therapy would be great too. I like have so much respect for the physical therapists, especially after shadowing them these past couple days. They really can treat so many and help so many different ways. And then yeah, like sports therapist is also really great. And I think honestly, like an approach with different views is also great. I think getting different opinions is not a bad thing. Um, and maybe too many opinions can be kind of confusing sometimes. So maybe not too many opinions, but yeah, a couple different opinions and feedback can always be great. So I think honestly, my answer to that is all of the above.
All right, this next question is asking about the residency process. Could you share what what the application process is like for podiatrists?
Sure.
Like how that match process happens and what does the application kind of entail?
Yes. Yeah, I mean that's actually like perfect because I just kind of went through all of that this past year. So I honestly can remember that so much better than my medical school application because I barely remember my medical school application, but definitely can talk about residency application because that was so recent. So yeah, basically you finish your third year of podiatry school. It's 4 years, but you finish th 3 years. By that time, you want to have taken, so we have board exams in podiatry school, and you have to pass at least two of them to be matched. So you take the first one after your second year of podiatry school, and then you take your second one actually during your fourth year. But during your fourth year is when you start preparing yourself really well for residency applications. And honestly, even before that, you want to make sure that you're setting yourself apart. So whether that's leadership, volunteer, all of that. But fourth year is actually when you start doing we call it externships. It's basically 1 month in about 5 to 6 hospitals that you're interested in doing your residency. So like basically your top 6 residencies that you want to go to, you do a month at each. So it's like kind of a great way to see if it fits you, if they like you, if you like them, if you like the city, like how it feels for both of you. It's almost like a 1 month interview. And yeah, so you start that in the beginning of your fourth year. So for the first 6 months of your fourth year, you're doing these like externships. Each month, different location, different residency program, and see if you like it. After 6 months, everyone has interviews. And how it works, at least in podiatry, which is really great and convenient, is that all the interviews from the whole country, from every residency program and every fourth year, all meet at this one hotel. And this year it was in Chicago. And everybody meets at the same hotel, and you actually have your interviews in the different hotel rooms. So it's an interesting concept, but it's actually really convenient, so you don't have to fly to. I did 9 interviews, so thankfully I didn't have to fly 9 times to 9 different places to do interviews and pay for it all myself. Like everybody just came to Chicago and um, did interviews there. So again, I applied myself. This is just for me. I applied for all 6 of my um, externship places, as well as a few couple others that I just visited that I was also interested in. So interviewed for all of them. Interviews are about 20 minutes, really short. They ask you some social questions, they ask you some academic questions, maybe go through like a case of basically you need to be ready for anything, basically. Some of them tested your hand skills, so some of them wanted you to like suture really quick or like stack certain things really fast just to see how your hands worked. Just and yeah, so after Chicago, that's in January. So I just had mine this past January. Then you can rank. So it works just like MDDO schools. Basically, the student ranks in order from their number 1 through, for me, it was number 9, of which ones they want to go to. And then the residency program ranks the students from 1 through however many students they want to rank. And then it's this ranking process, match process. So after everybody submits their rankings, I think that's in like February or so. Um, like an algorithm does the match process where, if you both ranked each other number 1, it matches you. If you rank something else, I don't know, I don't even know how the algorithm works. All I know is it has a slight preference to the students ranking. So anyway, that's how that works. So an algorithm matches all the students to all the places. Obviously, there might be some people that need to scramble, so they need to go through this scrambling process for a week or 2 at the end where, the positions that haven't been matched into, they just have to go through basically that match process again and interview again really quickly and then match it. And then yeah, we had match day on, I think it was like middle of March, maybe March 16th or so was our match day, where just like the other medical schools, we open envelopes and find out that day for sure where we're gonna go for the next 3 years, and it's super exciting. And I was just really grateful that I matched into my number 1 program, and it was a great day. And then at that point, yeah, basically that's how you match into a residency program, and then from there you just have to do some paperwork and start getting ready for your new move to your new hospital. So that's how it works for us in podiatry.
That's super cool. I think what you highlighted about like having the interviews like in one place is like really convenient. Instead of like
So,
you kind of like all the students flying to different residency programs or like all over the US. I think that's like super convenient for students. Um,
yeah, it's super convenient. And like honestly, because we have already traveled there anyway to do our externships, like especially like like I had already traveled by that point to like 6 different places, like 6 different hospitals. So, you already kind of do most of your interview during that month, to be honest. Like you really want to impress during that month. And then during your 20-minute interview, they can kind of already know whether they want you or not. So anyway, yeah, kind of it's so nice that we don't have to travel again to all these places for another interview.
And then that's something I'm assuming is not pretty common for like other residency programs. Like
I don't
usually
know.
you.
I'm not
Mhm.
sure. I honestly don't know like exactly if it works similarly for MDDO schools, and I don't think it is similar, but I can't say I can't speak to that. I don't know.
And for like the application process itself, is it like kind of similar to the MD DPM like when you're applying to med school or a DPM school, is it like why do you want to do residency at this specific school? Or is it like is there so you send like your board exams and then you
Yeah.
answer that question pretty much?
Yeah, for us, yeah, we basically had a statement. I don't think it even had a prompt, to be honest. It was just like I don't even remember if it had a prompt. I think it was just like write a statement about yourself or something. I don't know, like but it's basically like a common application. So it's a common application amongst all the programs. So you only have to do it once, thankfully. So you don't have to do one different one for every program. So all the programs see the same application. So you just make it pretty general about like why you would be a good resident or something like that, or what qualities you have. You need 3 letters of recommendation. You need to send a CV, curriculum vitae. You need to, what else? Write about your leadership opportunities and research opportunities that you've done, any awards, any scholarships, stuff like that. You can kind of list it. So yeah, kind of again, kind of similar to med school application, but um honestly not that bad.
And you also said earlier that there's like for DPM schools, there's like 100% like residency match rate.
Mhm.
Um, and is that for like all DPM schools throughout the US, or is it specifically to the program that you're in that has a 100% match rate?
Yeah, I think it's basically all of them. Like once you've finished fourth, well, like it's not necessarily everybody that starts first year graduates and does it because some people like it's hard to get through the first year sometimes. But if you've gotten through the first, second, and third year and you've passed your boards, that's another thing. You kind of have to pass your boards before being able to match. But once you've done that, then everybody basically matches, like because there's honestly more spots open than there are applicants. So yeah, I don't know what exactly the numbers are off the top of my head, but I know there's at least like, you know, even if you might not match into your number one choice, at least at the end of the day you're gonna have a job. And you're gonna be doing the thing that you want to do, which is podiatry, which is something you go towards from the very first year, so you already know you're gonna do that. So yeah, basically it's really nice. We don't have to worry that, only 90% of us are gonna be whatever matched. At the end of all of that, it's like we know there's a spot for everybody. And you just have to kind of pass these board exams. And they give you like at least three tries to pass these, and pass your classes. And yeah, you're good to go after that. So that's something that's really nice about our specialty is that there's enough places for all of us to be in.
Well, that's so reassuring. I feel like that's like something that like first or like med students like when they first get in, they're like, okay, I got in. And then the next step
Yeah.
is like, okay, how do I apply to the next step, which is residency? And then I think that could be a source of like stress and like anxiety for a lot of students.
Yeah, because in MDDO schools, like, first of all, you don't even know if you're guaranteed to match into, that particular specialty. Unless it's like a very, common specialty or like maybe primary care might be more guaranteed. But even that, like, you're just not guaranteed any specialty until match day, until you're there for sure. And especially if it's like a competitive, specialty, that's even harder to match into. And that, what if you like you really like went through med school wanting to be whatever, like an OBGYN, for example, and then you match into like radiology and then you're just not happy, like I don't know. I mean, I'm sure there's pathways to like somehow do OBGYN, but it's like it's just I don't know. You just don't have any of that doubt when you're in podiatry. Like you know what you're going into. You know if you get through, some of these years that you're gonna definitely gonna match. And so that's pretty awesome.
Another question that I have is like, what kinds of like clinical experiences did you do when applying to DPM school, or did you not really have as many? Do you do like more volunteering, or what kinds of like clinical experiences did you kind of do, if any?
Yeah, yeah. Again, this is very personal. Like it's different for everybody that applied. Me personally, I was a scribe at at like a clinic, and then I volunteered at a hospital. And then I mean, it was kind of like the basic pre-med stuff, I guess. It wasn't anything out of the ordinary. Like did some scribing, did some volunteering, again, shadowed a little bit, and I think I guess I did a little bit more research. So I was like did a lot of research during my like Berkeley years. But clinically, I think that's all I did. I didn't do like a ton of clinical things before podiatry school. And you don't like, yeah, it's good to have it to know that you're okay in the clinic. And again, shadowing is super important, um, school definitely prepares you really well. At least my school like prepared us really, really well. Ever since something I loved about our school is actually we start in the clinic in our first year. Like we're already seeing patients as first years. And then we do more as second years and third year is like basically all clinic. Like we're in the clinic every single day, like being the first one to see the patient and presenting to the doctor and basically like seeing the patient from the beginning to the end of their appointments. And then fourth year, yeah, we're out in all of these externships, also seeing patients. So it's very, I think, podiatry school prepares you really well in terms of clinic. And then beforehand, yeah, I just did some volunteering, some scribing, and that's about it clinically, I think. Yeah.
That's great to hear. Another question, I was like kind of thinking about is like, do you think your studies like techniques in like undergrad compared to like in DPM school, do you think like it changed a lot? Or do you think that transition was like hard to do, or was it kind of like I'm like you're still studying, but it's just more focused?
Yeah, I see yeah, no, that's a really, really great question. And again, it's maybe different from me and other students, and everyone's journey is different in terms of their studying techniques. For me, I felt like I studied well during like community college. Honestly, like every year, I felt like I changed my study habits. And honestly, every class, like every professor is very different. And I feel like I kind of changed my study techniques depending on how their class was outline, starting from community college, to be honest, like from community college through UC Berkeley and then through podiatry school. But your question specifically between UC Berkeley and podiatry school, it did change. It did change a little bit. Like I felt like I st started doing way more like flashcards, like Anki. So I loved me personally, I was an Anki girl. Like I loved you doing Anki flashcards and making them. I actually like from my school, I we didn't have any like pre-made decks that were passed down to my class, but I started that starting from my class. So I made like all these flashcards for all of my not all of my classes, but a lot of my classes. I took a ton of time making flashcards for myself, but also to be passed down. And then I started that trend of passing it down. So, I sent all my cards to the year below me, and then they added onto that and made it even better, and then sent that to the year below them, and now it's like thousands and thousands and thousands of cards that are in these decks that people can use. Anyway, so yeah, I definitely did that way more in podiatry school, is used a lot more flashcards. It just works better for me in terms of like the amount of memorization we had to do for, our pharmacology, like learning all the drugs and like bacteria and anatomy. Just flashcards were just the best way for me to remember it. And for me, I usually made it in a question and answer format. So um, I usually had I literally put myself in the mind of the professor's mind, and I'll be like, okay, from this one slide that I'm looking at right now, what are the questions he can ask from these bullet points that they have on the slide? I literally like tr translated them into questions. And yeah. So instead of I don't know why this is the fact that's coming to my head, but like the mitochondria is the powerhouse of the cell. Like I would make that a flashcard and be like, what is the powerhouse of the cell? And then make the back of the card or the back of the Anki the mitochondria. So that's kind of how I did my studying, was kind of question format, putting myself into the professor's mind. And sometimes I was able to actually like guess the actual questions that came up on the exams because I just practiced that so much, and it helped out with my critical thinking.
That's a great study tip. I didn't really think about like formatting questions in that way. Would you say that um I'm planning to take my MCAT like this summer. Do you like think that the like what you're studying or like the way you're studying is kind of similar to like how the MCAT is structured? Like your um I guess like the concepts or like your tests, like do you think like it's kind of similar to that, or is it like very different from like the MCAT? Like
Um,
MCAT is kind of very different.
Oh my gosh. One thing I can say is that the MCAT is still the hardest exam to this day that I've ever taken. Like, I would never trade that for any of our board exams. Like, that is, like, MCAT is tough. So, just know that. I know a lot of people say it's not the toughest exam. For me, so far, the MCAT's the toughest exam I've ever had to take. Um, and honestly, it's harder. Like then for me at least, like cars, like there's no way around that. Like I cannot get over cars. Maybe like biochem is the same, maybe, but I think I actually did learn to study a lot better during my MCAT studying days. Like I think I actually started that flashcard method during my MCAT studying days. And then I only refined it during podiatry school, but I think I like actually started that during my MCAT studying days. Um, but no, like I felt like I don't know. I feel like the MCAT is such a nightmare. Like I don't even want to think about it. So I'm so sorry you're going through that because MCAT is so difficult. Yeah, just I don't even know. But it's definitely not like podiatry school. Like I felt like podiatry school was way more straightforward for me, and the exams were more straightforward, and the board exams we've had for podiatry school are way more straightforward. It's literally like it's not there's no passages. It's like, one question and like one sentence questions and then answers, like four or five choices, and that's it. It's like so straightforward. So you either know it or you don't know it, and that's how it is in podiatry. But yeah, MCAT is harder.
You don't want to take the MCAT for funs and giggles.
Never, ever, never.
Trinity wants to take it again for funsies.
I was actually just thinking that it's been, when Kirsten brought that up, that it's been almost 3 years for me already since I took it.
Oh,
I will kind of piggyback off of what Dr. Fogerty said there. I started using flashcards when I started studying for my MCAT, and then I never looked back because for me, at least, that was the best method for every class I took after that, like the memorization. And I did the same thing where I structured it as the question, and then I'd get to the exam, and five of the questions on the exam was a flashcard I had practiced, 20 times over the course of the semester, and it was just like walking right through, and I was like, yep, 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 good to go. So yeah,
Yeah.
the MCAT's hard. But you kind of just have to, I just kind of gamified it almost to myself. And I was like, this is like a 3 month, preparation for like this big event. And, I tried to make it fun. And at the end of the day, I got the score that I wanted and I only had to take it once, which is what I was happy with. So yeah,
Yeah, you
flashcards for
score, but the
sure.
thing is, you're the outlier, though. I mean, like your score is like not humanly possible. Just saying for
Yes, it is.
mortals, for mortals.
Yes, it is. Yes, it
Um,
is.
but yeah. So, but I mean, yeah. But I think gamifying it is, I think, like, is actually really funny because one of my professors that I know, she's really involved in like creating games and learning, and they're finding like through research that a lot of these like games that they've created for studying, um, they've actually like helped with studying, which, hey, if you could make it fun as a game, if they could make an Assassin's Creed game for learning, I would do really well. Um, but did you guys use digital cards or physical cards?
Digital for me. I use Donkey.
Yeah, I personally use um these cards, physical cards, but just because I'm old school and I'm so used to it. But I've also used digital stuff. I don't use Anki. I've used Remnote, which they have like this whole AI feature where you could take PDFs and they turn it into flashcards, and it's much easier. But that's just for the lazy people.
That's cool too. Sometimes I wish I knew that so that I could use that. Because making flashcards are like took so long for me.
Mhm.
But then at the same time, while you're making them, you're like thinking about them, so it's already a first pass through anyway. And honestly, I feel like I became super picky with my flashcards. Like I couldn't use anybody. Like other people would like offer to, make flashcards with me or like I don't know, like or send me their decks, but like I don't know why. I just became so picky with them that I like them in a certain way, like how I, did my question and answer thing that it was hard for me to like not only, it's not that I didn't trust that person, it's just that I didn't want to rely on someone else for like my exam score and stuff like that. So I just wanted to rely on myself, basically.
Yeah, the digital one, because I kind of use it as a way to consolidate like what was already on the slide. So I had to decide what was worthy of being made into a flashcard,
Yes,
or
that.
something, yeah, something that I already knew or knew that I could, you know, bring about with like reasoning. And then the reason why the digital ones are so helpful, especially Anki, is you can adjust the settings. We have a whole video on this too, but I don't know where if you have the link there. Back when I was using it a bit more. I haven't used it in a while, but it does all the space repetition for you. So it does the science for you of when you need to see that card and when you don't, and just trust the algorithm. It works, it knows. And you can adjust the settings of like my assessments in this many days. This is how often I need to review and that kind of thing. So yeah.
Yeah, I love that. I love that aspect. And it's exactly what you said. It's not that I didn't trust someone else. It's just like, there's like 1,000 facts in these PowerPoints, and it's like you can't make, or you could make 1,000 cards, but it's not efficient that way. You have to kind of pick and choose which fact you think the professors are going to be like, which is more high yield, I guess, and which ones you're going to be okay with not studying. So that just picking and choosing process is something I guess that I just wanted to do myself, um, so that at least I can blame myself if I didn't study something, and just didn't choose to study something. Anyway, yeah, totally agree.
It's like a little bit of a change in topic. I had a couple questions that I wrote down over the course of your talk too. I was wondering what were some of the things that you prioritized or were paying extra attention to when you were selecting the programs for residency and how you ranked them? Like what were sort of the intangible things that you were looking for in your program?
Such a great question. So I went into externships, Picking the externships is quite important because that's already like your top should be like your top six. And I that was kind of harder for me because I like didn't know much. We just came out of our second year basically and just came out of board studying and just taking our board exams and I just kind of did it based off at that point, unfortunately, like I didn't know much, so I did it based off of kind of just what I've heard, I guess, of these programs and their names. Um, and yeah, so I kind of based it off of that. And then I kind of went into it with a very open mind. My priority for me and what I was looking for was like great mentors. Like I wanted to be excited to learn every day from these attendings. I wanted a broad base of podiatry and good scope in terms of I wanted to make sure that the program was doing, all the different kinds of podiatry that we could be seeing. So not only just, bunions or not only just diabetic foot care, it's like it encompasses all of it. It's something I was looking for as well, and just a great team to work with. Like I wanted to make sure that the residents got along well with each other, I didn't want to go to a program that was super toxic and somewhere I would be kind of nervous about seeing people every day or other residents. Like that's not something I wanted to look or like a toxic kind of environment in that way, because some programs can maybe be like that a little bit. And yeah, I just wanted to go somewhere that I felt excited to wake up in the morning and learn. And of course, location is something to consider. So if you liked the city, if you liked the area, if you can see yourself living there. I think my top two, there was one in California that was really close to where my family was, and one in Boston. And it was such a hard decision, I remember, because, I know I love California, I know I love the Bay Area, and that one was such a, strong program as well. But I also just really loved my experience in Boston, and I honestly like what made the last kind of difference for me was that I just really got along really well with the residency director in Boston a little bit more, and just felt that I would be able to learn more from him and just like the environment a little bit better in Boston in that particular program. And just was ready for a change. Like I've lived in California basically my whole life, and I was ready to experience something new. So yeah, I kind of took that leap of faith and put that as my number one in the ranking. But yeah, I mean, people could be looking for different things. If someone really wants to do a lot of trauma, a lot of ankle fractures, like they might be looking for a program that does more of that. Or someone only wants to do hammer toes and bunions all day as a podiatrist, they could look for a program that focuses a little bit more on that. But for me, I just wanted something that was well-rounded and great mentors, great teachers, great people is something I was looking for.
Yeah, I can definitely relate to being a little bit torn that way. The two schools I'm waiting to hear back from, one is, 5 minutes up the road from me.
Yeah.
And the other one is like almost all the way on the West Coast. I'm basically like in the same area as Toronto, like close to
Oh,
Toronto.
okay.
So it's like one or very, very far away. So I don't necessarily get to rank them, but those are like the two options that I'm left with now.
Sure.
And very different. And then I had another question, and I was just, now that I'm in the clinical research space, this is all I think about all day.
Yes.
I was curious what the research landscape is like for podiatry and what kind of opportunities there are for academic medicine for people that go to a DPM program.
Yeah. I mean, research is definitely emphasized in our DPM programs. I think even not our school, but a lot of podiatry schools like require you to publish at least one paper by the end of your school, like end of your training at your school. There's tons of journals that are out there for podiatry, but of course you can submit to any journal that you think would accept it. But yeah, I mean, I think it also depends on how interested you are in research yourself. And oh, that's something also in with residencies as well. Like certain programs emphasize a little bit more on research and want to publish more papers and posters and stuff like that. So that's something you could be looking towards. And again, may require it more than other programs. Um, and yeah, there's plenty of opportunities. Even in my podiatry school that I went to, we had a motion analysis clinic where we could even look at, how your gait was as a patient and measure, even how you walked and ran and how people use. I think there was a study on heels, study on like the controlled ankle motion boots, and anyway, yeah, there's plenty of research opportunities, and thankfully in my residency program, I think we have like an unlimited funding for that, so that's amazing. And yeah, there's the sky's the limit really for research opportunities in podiatry if that's something you're interested in. And actually, one of my really good friends, he was able to, I think he got his PhD before going into podiatry. But I think there might even be a podiatry program out there that you can combine with a PhD program at the same time, if that's something you're interested in, and pursue both research and kind of clinical podiatry as well. But anyway, he's doing amazing and publishing so much, and he's going to go into this incredible fellowship this year. Um, and on top of that is such a nice person as well. So that's always nice to see. But yeah, basically there's plenty of research opportunities if that's something you're interested in.
Great. And then the last one I had written down, we talked a little bit earlier about some specific advice for like the ballerina community. Obviously, a lot of stress on their feet. And I was just kind of wondering what kind of education you provide to like everyday patients that might not be undergoing like athletic, rigorous movements with their feet, but like just general things that people don't do that they could do to like have preventative measures, especially as like people get older. I've talked to like some older patients and they start to have a lot of issues with their feet as they age, and maybe they just weren't doing the right things when they were younger. Just
Yeah.
curious.
I mean, one good tip for anybody is to wear like really supportive shoes. Some things you can look for in a shoe is just like stability. Like you want to twist the shoe and bend the shoe to see if it's super bendy, then it's actually not supporting your feet very well. And if it twists super easily, like that's a shoe that's not supporting your foot as much as it needs. So find like a really great sneaker that you can wear just to support your foot as you're walking all day and moving around, especially if you have to be living in a lifestyle that you're standing a lot. But even if you're not, I think it's important to wear supportive shoes or just have a pair of really supportive shoes to wear. Like that will really help your feet out in the long term. And honestly, like stay active. Like I think it's great to keep your body moving and obviously if you have an injury, you don't want to like walk on it too much. But if you don't, like stay walking, keep active, and that will only really help with your health in general. And if your health is pretty good generally, like that will help your feet. Oh, a lot of people get like ingrown toenails, so that's kind of specific, but you want to like you don't want to round, so whenever you cut your toenail, you want to cut it kind of straight across, maybe a little bit on the edges a little bit more, but you don't want to cut it completely curved because the edge that you cut when it's completely curved, like that can be sharp and that can grow into your skin again. So you want to cut it kind of straight across if possible, when you're cutting your toenails. And yeah, if you have any concerns, like know that podiatry is here for you, even if it's something you think is small. We're here to take a look and never feel afraid to come talk to us. And um, yeah, we see again anything in the foot and ankle is under our scope. So yeah, come say a hi if you ever have any issues with your foot and ankle.
Awesome. We have like another question in the chat about I think this one came up like when you were talking about like the MCAT. The students asking if there's any tips for test taking.
Yeah, I've taken a lot of tests. I think in terms of minds, I mean, like, there's obviously like a lot of like tips in terms of like, make sure that you read every question properly. Like, of course, don't forget to, I always like highlight or circle if it's on paper, which hasn't been on for a while, but if it's ever like, you know, they're t they kind of the question has like a knot in it or like something that might throw you off in that way. Like I always circle it or highlight it when I see the question just so that it doesn't throw me off when I read the answers. Anyway, but not I won't talk too much about those. Like make sure you read the questions, all the answers. Make sure not to, skim through it too fast. But in terms of mental mindset, I take it very similarly to like a live performance. It's something I took away from when I was performing a lot, is that sometimes it's like out of your control. Like what you do up to the test is in your control. Like you can study as much as you want. You can prepare yourself as best as you can. You do your flashcards, might have to sacrifice whatever, going to whatever, something fun to study, or not. Maybe you do want to like prioritize whatever those fun times are in your life. And but up to that moment of the test is up to you. Like you can study a lot, you can do your best. But once the test comes, it's almost out of your control. You like, of course, want to read the questions really well, but you have what it is in your head at that moment. And what I want to say is like don't be too hard on yourself with every exam. Do your best in terms of answering the questions. Strike out the ones you don't think are correct. And read it properly. If you don't know it, you don't know it. Like that's okay. Keep moving forwards. I think, what I've learned throughout podiatry school is after taking so many exams is like it's not the end of the world if you don't do well in an exam. It can be hard, but don't be too hard on yourself. Like be patient with yourself. And it's, a learning process. Like if you have, anything that you learned from that process of taking that exam, like apply it to your next exam. But that's all you can do. You can't regret, whatever it is. You can just apply if you need to change up your study habits or talk to the professor. Um, but don't be too hard on yourself when you're taking exams, and take your time and yeah, read the questions properly. And yeah, that's all I would say. It's out of your control sometimes at the end of the day. It's up to the professor, and you all you can do is do your best. So if you've done your best, that's all you can do. And don't be too ashamed of yourself if it doesn't go well.
Yeah, I love all those tips. I think those can be applicable to like almost like any test that you kind of go into.
Yeah.
We have like some other questions as we start to wrap up. There's this like our next question is what aspects of ballet training helped you to become a medical doctor? Do you think it's like the discipline, or are there any parallels between ballet training and becoming a doctor?
hmm There actually are like a lot of parallels, I feel like. I think first of all, I think dancers are so smart to begin with. Like, actually, when I was dancing, I was so like self-conscious that I wasn't smart enough to go into medicine. I was like, again, I actually was homeschooled from the time I was 12 to finishing high school. Like, I only did online school, and I was like, I'm definitely not ready for this profession. Like, I'm definitely not smart enough, is what I thought. But again, like kind of what that question already mentioned, like ballet teaches you, or any kind of like, sports and high achieving activities, really help you to learn how to discipline yourself and know how to improve yourself, daily and apply yourself to anything. So, yeah, I took those same things and applied again, kind of what I was talking about with the performance things, like where, you can prepare yourself up to a performance and then whatever happens on stage happens. I kind of took that same thing with, my exams. Also another parallel is at least in the operating room, is that you have to be very spatially aware. And it's the same with ballet and in ballet class and actually being in a ballet company, especially in the corps de ballet, where it's like all the dancers in the in the groups. You have to be really spatially aware of everybody around you, and your lines and everything as a dancer. And every time you take a ballet class, you have to be really spatially aware of everyone else so that you don't like kick someone accidentally or like run into someone. And that same aspect actually applies in the operating room because you have to be very sterile and work in a sterile manner in the operating room, especially when you're scrubbed in, where you can't be bumping into people, you can't be touching things. You literally have to keep your hands like sterile. You can't even touch yourself. Like you can't touch anywhere past like this level, on yourself. You can't touch your face, you can't touch anything. Like, and you have to be careful of everything around you, and be very spatially aware. So actually, I feel like my training in dance in terms of like things around me actually helped me a lot in the operating room where I don't think I've ever broken sterile field. And as a student, that's like apparently things students do sometimes, which is totally normal. But I think actually my ballet training of being very aware of people around me and things around me actually helped me with that, thankfully. Um, Yeah, so that's definitely something. And then again, the discipline aspect of it, of being able to push yourself through hard times. And yeah, those are kind of the main things that pop out to me. And actually, one last thing, suturing. Like, as ballet dancers, we actually have to like sew our own point shoes and sew our costumes sometimes. And that like sewing skill that I had and learned as a dancer actually helped me a lot with my suturing. So that's one last thing as well.
I didn't realize that there were so many like parallels with that. I think that's
No.
really cool to see.
Yeah. Yeah.
I think this might be our last question or like one of the last ones. Are there any tips for personal statements for students going through like the non-traditional route?
Oh my gosh. I think honestly, like the non-traditional route is gives you like even more material to work with for a personal statement. Like it makes your life richer, it makes your story richer. Like so, hmm. Yeah, I would say again, kind of ask yourself why. What would make you kind of stand out amongst 10,000 applications? Like, what makes your story unique? Or like, what would, pop out at someone reading your application, like from your life? And, or like, look back at your experiences and somehow relate it to how it's made yourself a richer person or rich with richer experiences and kind of take the time to translate that into your personal statement so that you can, express how you've done things that are different. And again, those are honestly great. Like non-traditional students like have that, they may have taken longer to come to medicine, but they have that unique aspect of their lives that's not the same as everybody that's applying. And honestly, that I think that will stand out a lot to the people reading their statements. So um, I mean, yeah, I don't have like any specific tips, but maybe like bulleted out kind of like the format that you want to say, for each paragraph, um, about, different experiences and how that makes you, you know, uh, a better doctor. Even if it's completely not in medicine, I think those experiences again can make you a better doctor. So trying to translate that with each experience that you've had, um, and maybe the skills that you learned in your other, aspects of your life and how that makes you a richer doctor is something that I would definitely include in your personal statement, but definitely not easy to draft. I think I did like 10 drafts on my personal statement back in my med school application days. So yeah, definitely took some time for sure.
Okay, I think those are all our questions, at least in the Q&A. Is there anything else you wanted to add, Trinity or Jubin?
Hmm. No, not for me. I think we got lots of topics covered today. Thank you so much for your time. I know we're at like 9:30, at least for me, an hour and a half. So coming up on time, I'll just let Jubin chime in here for a little bit.
Good seeing you.
Yeah.
Have fun in East Coast, and just remember, whenever it's cold in Boston, in California, it's 70 degrees, and we're walking in our t-shirts and shirts.
It's not so bad. You'll be fine.
Well, sorry,
Get
Miss
used to it.
Canada.
Yeah, you get used to it.
Oh my gosh. No, thank you all like so much for all your questions. Like I actually really enjoyed this and talking, about my journey and a little bit more about podiatry and just spreading the word about our great field. And yeah, definitely consider podiatry if you're like in this process and have any questions. You can always reach out to me on my Instagram. It's just my name, Miko Fogerty. So definitely reach out if you have any questions or want to clarify anything about my field or yeah, I'm always here for you guys. And again, thank you again for your time and watching all of us. Like I really appreciate your time as well.